Welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us again. Going to be speaking with Mr. Marc Meachem this morning, Head of External Affairs U.S. at ViiV Healthcare. He's joining us here on the program to talk about a recent report released by ViiV Healthcare called Tal Como Soy, Here As I Am. It analyzed multiple factors that contribute to the disproportionate impact on Latinx LGBTQ plus men's ability to access preventive care and HIV treatment. Welcome to Health Professional Radio. Mr. Meachem, thank you so much for joining us.
Thank you for having me, Neil.
Well, as Head of External Affairs U.S. There at ViiV Healthcare, give our listeners a bit of your professional background. Talk briefly about your position there at ViiV, and then let's talk about this disproportionate access to care.
Sure. So ViiV Healthcare is a company that's 100% focused on HIV medicine. So we research, develop, and market medicine for people living with and affected by HIV. And in terms of external affairs, I think I'm really blessed to have a job where we're focused on eliminating the disparities that exist in HIV in the U.S. and accelerating response for the communities that are most impacted. And in the U.S., those are racial and ethnic groups, people of color who are most impacted, disproportionately impacted by HIV.
Tal Como Soy, Here As I Am. Talk about this research. What was the impetus of the research in the first place? And talk a little bit about why some of these disparities exist.
Well, part of it is, and we always focus our work in the epidemics. So when you look at the epidemiology, you see that, as I said before, young Latin men are particularly overrepresented in HIV diagnoses. So when we look at the new cases, as of 2018, that was the latest data set that we had. There were about 8,000 Hispanic, Latino, gay, and bisexual men who were newly diagnosed with HIV, and 2/3 of those were young people, so between the ages of 13 and 34. 1 in 5 of those people also were diagnosed late. So instead of getting just an HIV diagnosis, they had an AIDS diagnosis, which meant they had opportunistic infections. And one of the most critical things we've seen in doing the work and in working with communities is that people really need to get an understanding of the community to be able to engage with it. And we firmly believe that you can't solve the problems outside of the community. You can't solve the problems without the community. And that's what Como Soy was about. So it was a 10-month listening tour. It went kind of coast to coast. So it was in Los Angeles and Riverside, border towns in Texas and in Houston, Chicago, New York, Miami. And we also in Puerto Rico, we were in San Juan, but we also went to Mayagüez. So we wanted to make sure that we had a diversity. We had major metro areas and we had some smaller cities and towns in the mix. And it was kind of 3 layers of listening. I think one layer was, listening to individuals. Mm-hmm. So, and what we did is we kind of went to communities and we looked for captains. We looked for people who were connected to the community. And then we asked those captains to gather together a group of, 10 to 20 some men, Latinx, gay, and bisexual and trans men, and engaged in 2 to 3 hours of conversation. Another layer of this was storytelling booths. So we worked with an organization that has an audio recording booth. So you can just sit on a booth and tell your story. And so there we collected over 156 stories of people's lives and experiences. And the last thing was at the organizational level. So we engaged and interviewed and spoke with 41 orgs that are working in HIV and in health for Latinx men and the Latino community. And so when we put that all together, we engaged with about 760 men.
Do you think that the insights from this research will greatly impact healthcare as it pertains to access to care for HIV?
Oh, absolutely. Absolutely. I think if we act on it. Mm-hmm. And so in terms of some of the insights, let me share a couple of them. We have five primary insights. The first one was that family and community are central to the lives and identities of these men, and it shapes their healthcare for better words, so that it can be something that is supportive, but it can also be something that's limiting in terms of stereotypes or expected behavior, or people not wanting to talk about sexuality and other issues. Another insight is that, and I think this is a critical one, is that interruptions in care and treatment can happen for many reasons, and sometimes beyond people's control. People can lose insurance, people can change jobs, people can have to move. And even if you don't have some of those factors, sometimes, you may be on one side of town, your health care may be provided on another side of town. If you've got, the transportation issues, if you don't have reliable transportation, there are a number of things that can get in the way. And I think that one of the things in the field of HIV is I do think we have this belief that, once someone gets on treatment, that's it, job done, and they'll stay on it, happily ever after. Mm-hmm. And so the understanding that interruptions do happen and that we need to be aware of that and to react to that and kind of get that person reconnected as quickly as possible.
Well, it seems like the healthcare provider has to have many insights into many aspects of a patient's life, not just the treatment that they're undergoing. What do you think some of the main lessons are to be learned by healthcare providers to improve access to care for their patients?
Well, I think the first one is kind of what you hit on, Neil, is that they need to engage with communities and they need to get to know them. And so, some of the things I've seen is clinics do open houses where they invite the community in, where they do events in the community, where they go out with their staff and engage with people. So I think, getting to know the community is a critical thing. I think, research, quite frankly, is another. So I think reports like this give clear insights and also give recommendations about things that can be done for the insights. And so I think that, after people might look at some of the existing research, they might do some listening of their own in the communities as well, surveys, et cetera. And I think the last and most important thing is, and I think this is borne out across a number of disease states, is that people need to be seen. We all see the data around the number of minutes and amount of time that health professionals actually have to spend with individuals. But we've also seen the data and research that shows that if you spend more time with people in terms of listening to them, understanding the things that get in the way of treatment, that get in the way of the outcomes that you're looking for, that can really make a difference. Another thing that HCPs and clinics can do to engage with the community is lean on the existing Latinx and Latino-led organizations that are in the community. So they really can be helpful in building those bridges and also in providing solutions that are community-led.
Give us a website where we can learn more about the report and more about ViiV Healthcare as well.
Absolutely. So you can go to ViiVHealthcare.com. That's V like in Victor, I, V like in Victor, healthcare.com. And also another way people are looking at the report, and the report was done in Spanish and in English, is to Google Tal Como Soy and with ViiV. So it's Tal Como Soy and then ViiV, and the report will come up in the search.
Great. Marc, thank you so much for joining us on Health Professional Radio, giving us this information. Appreciate it. Hope you'll return.
Absolutely. Thank you so much for the time, Neil.
Thank you. You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Marc Meachem, Head of External Affairs U.S. at ViiV Healthcare. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.